Babu George, HOD and Chief Physiotherapist at Gleneagles BGS Hospital, Kengeri, Bangalore. This gives me immense pleasure and happiness to share few words about physical therapy. During Second World War or after the Second World War, the many soldiers being injured, amputated, spinal cord injuries. The physicians and the surgeons did their part doing the surgeries, but apart from that, they thought we need to put back these soldiers into the field or into the work. Then they thought they wanted some specialist or some activities, physical therapy needed. That's how the physical therapy has been started with. Yes, I do agree. In olden days, physical therapy used to be with some modalities like ultrasound, infrared radiation, wax, maybe traction, or so on and so. But as the days goes on, the physiotherapy fraternity has grown like anything. Like it has been standardized, regularized. Now each and every state has its universities being accredited colleges. It's 4.5 years of course. It's a 4 years of duration of the study, followed by 6 months of internship. In this, followed by we have a specialization like orthopedics, neurology, pediatrics, gynecology, and cardiorespiratory, and also of course hand and community rehabilitation. I would like to highlight about my center, the hospital where I'm working, Gleneagles BGS at Kengeri. As all of you are aware, this center is predominantly does a transplant, and also it's known for the major trauma. Here we are more concentrating or treating the patients in critical care, especially post-operative. I would like to highlight the post-op surgery management is very crucial in any hospital to prevent complications. First and foremost complication which I would like to highlight, like a patient after the surgery, for example, like it may be an abdominal surgery, a thoracic surgery, or it may be an orthopedical surgery. Patient is restricted not to move, or patient is being admitted in the ICU. Then first and foremost, like respiratory condition, complication. Second thing, circulatory complications. Third thing, musculoskeletal muscle wasting, and then mobility is being reduced. So here, as a physical therapist, we play a vital role and preventing respiratory complications. Second thing, circulatory complications like DVT, atelectasis. And we, as a physical therapist, we start with an early mobilization. And also we do concentrate more on just physical therapy to prevent respiratory complications, early mobilization to prevent circulatory complications, and ambulate to prevent musculoskeletal complications. And once we do these activities as a physical therapist, it becomes easy for the intensivist to remove the drains like ICD or even urinary catheters. It helps to prevent the complications like ICU associated infections, catheter associated infections, and sometimes yes, we do play a major role when the patient has been intubated with the ET tube and the tracheostomy. A physical therapist plays a major role in clearing the chest secretions by doing the chest physical therapy and the suctioning. And third thing is not only that, when the patient, physiotherapist is involving in treating the patients, the patient moves out of the ICU, so that we do prevent the ICU associated complications. Second thing, when the patient starts moving around, patient recovers faster, and patient will be getting discharged. It also helps in a two-way, like the burden of the financial on the patients. Second thing, we are preventing the hospital acquired infections. Third thing, we early as put them into the daily activity, and then they can go back to their normal life. Yes, at Gleneagles BGS, we have full-fledged and some skilled physical therapist in a different field, like orthopedics. We have an extremely well trained, good physical therapist who handles any kind of the orthopedical conditions, sports injuries, post operative orthopedical conditions like TKR, THR, ACL reconstruction. Yes, it gives me a very good impression to the patient. Like when the patient is being mobilized early, and the patient gets the confident, and it builds the confident on the patient of activities and mobility. And also it's my pleasure to share that many patients comes with a pain related. Those days, it may be any pain related, cervical or lumbar. The option is only the surgery. But now the skilled therapists are available, correction of the posture, strengthening exercises, endurance exercises, stretching exercises, the pain management. Yes, it's like earlier those days, we used to have only modalities, but now the manual therapy and manipulation therapy, these kind of exercise therapy specialists like myofascial release, trigger point release, taping techniques, strengthening exercises, stretching exercises, endurance exercises. These makes the patient to get the fitness and go back to their normal life. And second thing, we have an expertise in a neurological department, neurodevelopmental training, motor relearning program, handling the head injury cases, spinal cord injury cases. It gives me I'm happy to share that, and also I'm proud to share that maybe 3 months back, we had an international patient coming all the way from Nigeria, having a tumor in the spinal cord. When the surgeon has been removed, is totally paraplegic, and the team of physical therapists at Gleneagles and Kengeri, we had taken as a challenging case, started with electrical stimulation, passive exercises, start slowly getting the flicker of muscle power, and gradually we started getting the muscle power and strengthened and made the patient to walk. It is one of the what I can say, like a big achievement which we did in our center. And also we have a very strong team in cardiorespiratory therapists, that's including me. We do work especially abdominal surgery, cardiothoracic surgeries. Especially we are the domain in lung transplant, heart transplant, and also in a liver and renal transplant. It's the biggest challenge in our hospital. Patient coming in the end stage of any organ disease, a patient mobility is being restricted, not on the toes. We prepare the patient for the surgery, and it helps them post-operatively to pull them out. So it gives me happy to share a few words about physical therapy. And many people having an illusion, understand that physical therapist is the only giving an ultrasound or IFT, shockwave therapy, or traction kind of this thing. It's beyond that. At Gleneagles, we do specialized and sound skill to handle any condition from pain to the transplant. Thank you.